The COVID-19 infectious disease level in the country has now officially been downgraded to the lowest out of the four-tier classification. Accordingly, there are changes in response strategies and management systems. Our Shin Se-byuck explains what has changed and what remains the same.
As of August 31st, COVID-19 has become a Class 4 infectious disease in South Korea, on level with the seasonal flu. Infectious diseases are categorized into levels 1 to 4 based on their contagiousness and other factors like reporting timing and required isolation. Class 4 represents the least severe classification. Consequently, sentinel surveillance of COVID-19 will be implemented. That is a major shift from the mandatory surveillance system that was being used to monitor the virus. COVID-19 had been categorized as a Class 2 infectious disease up until now. The national crisis level of COVID-19, though, will remain at warning. That's level 3, the second highest alert in a four-tier system. Other big changes can be found in medical response systems. Up until now, symptomatic individuals could have a rapid antigen test free of charge. But with the adjustment, now people have to pay up to 50,000 won. High-risk groups, though, such as those aged 60 or older, or those with underlying conditions, remain eligible to receive around 50% of the fee. The same goes for PCR tests as well. One-stop clinics for COVID patients and at-home rehabilitation services such as remote consultations with doctors will be terminated. But operation of ICU beds and wards reserved for COVID patients will be kept. As for financial support for people who contract COVID, only severe cases will be eligible. Living expenses will no longer be provided and the government covering paid sick leave for COVID will end. However, support for oral treatment and vaccinations will remain in place at no cost. Most of the public health measures will remain in place to better manage high-risk groups. Mask wearing at hospitals and group residential facilities remains in place. Preemptive testing for inpatients and medical facilities along with caregivers and staff will continue as well. Shin Se-byuck, 아리랑뉴스.